Turning now to the big shift in the fight against COVID-19 as kids return to school, the CDC has relaxed several key COVID guidelines, including testing and social distancing. The agency now says that you don't need to automatically quarantine if you have come in close contact with someone who's infected. So for more on these changes, I want to bring in Dr. Jay Varma. He's the director for the Weill Cornell Medicine Center for Pandemic Prevention and Response. Thank you so much. Let us get started. So, the CDC basically said, listen, COVID's here to stay, so we have to figure out a way to live with it, which is what we've had been hearing for months now. What do the CDC recommendations signal to you about where we are with this pandemic?
Yeah, I think the CDC guidelines really are much more consistent now with probably the way most people are managing their lives and the way most businesses and organizations are managing this disease. There are still many people at risk. There's still a large number of Americans dying from this. But at the same time, I think the vast majority of people and elected officials have decided that they want to move away from, widespread testing, widespread quarantines, and shift to vaccinations, treatment, and then isolating only when sick as their primary strategy.
Yeah, I think that's a great observation. When we saw the list of changes, particularly the 6 feet distancing one, I was like, oh, that still applies, because no one really does it in real life anymore. Quarantining was one of the most significant changes, though, dropping the 10-day isolation after exposure. What factors could have contributed to this change? I think it was something that people were very confused about. How do you quarantine? How do you test? Why do you think they decided, okay, let's just limit it to 5 days and then test a couple times after that?
Yeah. So, just to make sure everybody understands, this is not about people sick. This is about if you were exposed to somebody, like a colleague who sits next to you or somewhere else. And to me, this is actually the absolute right decision. Ever since Omicron, and we've had these incredibly infectious viruses, and then also combined with the fact that there's much higher levels of immunity, both due to vaccination as well as prior infection. To me, it basically operates under the assumption that even if I know somebody has COVID who's next to me, I've likely been exposed to COVID all throughout society as well. I mean, we're just seeing incredibly high levels of risk. And when you have a disease like that, it doesn't really make sense, except for sort of higher risk settings like a nursing home and stuff, for people to remove themselves if they're not sick. Absolutely, people who are sick need to stay away. And so the recommendation is really very consistent with that. Wear a mask and try to get yourself self-tested sometime during the 10 days after your exposure.
And the CDC also changed sort of the guidance on testing, that if you were exposed but you don't have any symptoms, you really don't have to test. And so I want to ask you, at the beginning of this pandemic, testing was sort of one of the three pegs, that legs in the stool that was going to protect us. Where does testing stand now? I've heard all sorts of things about what tests can pick up and what they can't. What role does testing play now?
Yeah, and I want to make this very concrete for your viewers right now, because this is probably one of the most confusing aspects. My wife is a doctor, and I have kids who listen to talk about medicine, and they are always asking me questions too. So the most important tool for anybody out there right now are these rapid antigen tests, the tests you can get over the counter at a drugstore or a supermarket or anywhere else. They're primarily designed to tell you one thing: do I have enough virus that I can make other people sick? Okay, so they will miss some cases. That's why the sort of standard PCR is ideal if you're in a hospital or in a very high risk setting. But for the average person, the main question you have is, because you're going to know by your own symptoms whether or not you need to stay away from other people because you just feel sick enough. But the other reason to stay away is you don't want to infect other people. So I really recommend people use these rapid antigen tests. They aren't cheap, obviously, so you need to be careful about how many you can actually use. But use them to decide whether or not you're at risk of infecting other people. And that's the CDC guidelines include that. They say isolate for 5 days and then wear a mask for the next 5 days. But if you test negative twice, you can then leave and take off that mask.
And just quickly, kids are going back to school. The guidance has changed also for kids going back to school. Last year, my kid, she was in, they called it a cohort, which is sort of the smaller group. If somebody tested positive, the cohort would stay home. That's not the case anymore. How do you feel about that?
I think one of the most important things we've always had to balance are, the health risks from COVID, but also the health, social, emotional, and educational risks of having kids be out of in-person learning. And I think one of the most important lessons we've learned during this pandemic is that it's absolutely important for us to do everything we can to have kids in-person learning. My recommendation for parents out there is, if you are concerned, a one-way mask that is your child wearing a mask can help protect them. And I hope that schools do everything they can to allow people with that choice, so that kids who do choose to wear a mask, or parents that choose to have their kids in a mask, don't feel like they're being bullied or treated differently for any reason.
Great advice. Dr. Jay Varma, thank you.
Thank you for having me.